I always knew that my aunt never wanted what I would call very invasive life-prolonging means, such as breathing machines. But I also knew when she and I talked about it, she would not be adverse to using oxygen or IV therapy if the case warranted.
Mom has always, through the years, shared with us what her wishes might be. She always said she didn't want to be kept here on breathing machines and feeding tubes and things that, prolonged your life.
I don't want to be on no kind of assisted breathing and all that,
We never talked about end of life. It was just more like she would never die. She was just going to live forever.
She didn't want anything extraordinary done to prolong her life. So knowing that she's going to get exactly what she needs, is a comfort. It is a comfort.
Knowing the type of medical treatment you would like to receive toward the end of your life is very important. And making sure family members and doctors know is also very important. Until recently, there wasn't a reliable way to do that. That's where the Louisiana Physician Orders for Scope of Treatment, or LaPOST for short, comes in. LaPOST is a document that clearly says what kind of medical treatment patients want toward the end of their lives. Printed on gold paper and signed by both the doctor and patient, LaPOST helps give a seriously ill patient more control over treatment. The form works even if the patient later loses the ability to say what he or she wants.
The LaPOST document is different than the living will or the healthcare power of attorney in that the living will is really a lawyer's order, so it is a document that has to be translated into medical orders in order to be used. The LaPOST document actually represents a conversation that the patient or their healthcare representative or power of attorney has with the physician, which outlines their goals of care and the types of treatment that they want. And then that is completed on a document that then goes with them across the healthcare settings. The LaPOST document can actually be started by anyone who feels comfortable having the conversation with people about the kind of care that they would want. But the document itself can only be completed and signed by the physician.
Across our healthcare facilities, we see circumstances where our patients haven't thought about, planned, or discussed their end-of-life wishes and then become incapacitated in some way. This situation often leads to confusion, disagreement, and misunderstandings among family members. They are forced to make critical decisions for their loved one, or guess as to what that person's health care preferences would be. Advanced care planning takes the guesswork out of the situation.
Learning and knowing who the resident is really helps, building that relationship with the resident and their family members, sitting down, talking, listening to them. You don't have to complete that document right then, but just having the conversation and get them to understand what LaPOST is.
It was difficult to sit down and make it official in black and white. But at the same time, I knew that it was in my mother's best interest. It would be something that she would want. She would not want there to be any hesitation on a plan of action for her.
It's awful to have full control of somebody else's life and having to make a life and death decision for them and wanting peace in your family. I didn't want to do anything that they would resent me for, and I didn't want to do anything against my mother. It would have helped me a whole lot to have somebody talk to me and take me through the process. That would have helped.
There's not a struggle. You don't have that sense of guilt. Did mother, should we, could I, what ifs? The LaPOST document to me alleviate a lot of the stress and guilt. because now they are not the ones having to say, we're not going to do this for mom or dad. Mom and dad has already clearly outlined what that daughter, that son need to guide them through that process.
I completed a LaPOST document for my aunt about 1 year before she died. At that time, my aunt was not mentally able to follow the document with me. I had to make those decisions on my own. I'm very glad that I had that document. It made me think about things in a different way. Dying is not what you see on TV. It's not like Hollywood and in the movies. It's very real, and you do have a lot of decisions to make. And the document helped me to start thinking about these things, making these decisions ahead of time.
It gave me a sense of peace.
It's a tough subject to talk about, but a necessary subject.
It is an overwhelming feeling when you're making those kinds of very concrete decisions. Letting go of your family member is hard, especially a parent or a child.
It's something that's inevitable, and once they get it all understood, what's going to happen, it relieves them of any kind of mystery.
Let's educate, let's empower families and the ones we care for with choices of a quality and dignity end of life.
As stewards of our own lives, it's important for each one of us to consider our future healthcare plans so that we can truly make informed decisions about care and treatment that are consistent with our faith and our personal beliefs.